Healthcare, as of course you know, affects everybody from birth until the golden years. And we have two people here who are very intimately associated with the care of two of those parts of our population. One of the fastest growing segments of our population is what was often referred to as the baby boomers. But the fact is that now people over 50 and 60 are the fastest growing segment of our population, and it's not just about living long, it is also about living well. And our next speaker can address that and how these bills and these questions affect that segment of the population. Leeba Lessin, the president of CareMore.
Thank you. As Bruce said, I'm here to talk a little bit about the Medicare aspects of the bill. Certainly the passion here tonight is around the government option universal coverage part of the bill, but we do in fact have a government health care program for seniors called Medicare. I represent an organization called CareMore, which takes care of seniors who have chronic conditions or are frail and in nursing homes. We are an organization that is both a medical group and a health plan, and that fact I think is actually relevant for the debate tonight because it has already been said. We might reform the payment side of this, the insurance side of this, but if we don't also change the actual way health care is delivered and paid for, we will not be in a solid place economically. Now, people sometimes sort of roll their eyes and say, I don't know how you can get health care to cost any less. Well, let me give you a couple of little examples. It's possible to have people need to go to the hospital half as often. It's possible to have people's infections happen less than often. CareMore, for example, if you go to the hospital and you're a member of CareMore, you have half the chance of needing to go back as anybody else in the country. All that to say that if the government would focus both on how to reform the health delivery system, we think that 30 to 40% of the cost could come out simply from taking care of people better. To that end, we want to encourage Congressman Schiff and other members of Congress to pay attention to portions of the bill that have to do with things like creating accountable healthcare organizations, for paying physicians and hospitals for doing a better job and keeping people healthier, but also for assuring that there is special coverage for people with chronic and frail conditions. It's not possible for there to be a one-size-fits-all healthcare system, and it's already been recognized in current legislation that there are things called special needs healthcare plans. And we think if some of the savings, some of the healthcare improvements that have been defined and demonstrated over and over and over and over again in organizations that have focused on special needs populations, that we could actually finance all of the coverage for people with no additional taxes if our Medicare system was more efficient. So we're encouraged by the fact that many of the folks in Washington are paying attention to the fact that the healthcare delivery system needs reform, not just the insurance system, and it's been proven in Medicare that it's possible, and we're happy to have proven some of those examples. Thank you.